Hey everyone, and welcome to this explainer. Today, we're diving into a transformation that is happening at a truly staggering scale within India's healthcare system. We're going to be analyzing government data surrounding a massive digital milestone, one that is quietly but radically reshaping how everyday citizens interact with medical care and public health infrastructure.
250 million. Just let that sit for a second. 250 million. Or as it's measured in the Indian numbering system, 25 crore. When we look at public policy and systemic change, it is incredibly rare to see a single data point hit this kind of massive volume. It instantly creates a knowledge gap for us, right? What exactly just happened 250 million times to trigger this discussion? And what does it actually mean for the everyday person trying to get medical help? Okay, let's dive into this.
Section 1. The 25 crore milestone.
So, anchoring this right in the recent official government announcement, we see that over 25 crore digital OPD registrations underscore a rapid expansion of online health services. I really want you to feel the official scale and the sheer weight of this data point. We aren't talking about some hopeful projection or, an ambitious target goal for the next decade or a tiny localized pilot program. No, this is an actual documented reality. It represents 250 million separate, successful instances where a patient engaged with the healthcare system in a completely new digital format. This single piece of data is absolutely crucial because it shows us that a sweeping policy initiative has actually translated into widespread, tangible adoption right on the ground.
Section 2. Decoding digital OPDs. Let's move to and see how this builds.
To truly wrap our heads around 250 million registrations, we need to understand the interaction itself. A digital OPD is, simply put, an online registration system for outpatient departments. It allows patients to book their hospital visits digitally, completely bypassing the physical line. So, every single one of those 250 crore data points represents a patient who used a digital gateway for their first medical contact, instead of having to physically show up at a hospital just to get a spot in line.
Let's contrast these two realities, and this brilliantly illustrates why adoption is so incredibly high. The old traditional registration model, it means long physical queues, shuffling through endless paper records, and just immense friction for a patient who is likely already feeling vulnerable. Now look at the new digital model. Online booking, streamlined access, high efficiency. This stark contrast in the user experience is the main engine driving this massive shift. Think about it. When you offer a patient the choice between standing in a crowded waiting room at the crack of dawn versus just securing an appointment from their smartphone in the comfort of their own home, well, the frictionless path is going to win every single time.
Section 3. Expanding online health services.
Now, hitting that 25 crore mark definitely doesn't just happen by accident. As we unpack the dynamics here, we can see it's the direct result of a deliberate, government-led digital infrastructure push. We are witnessing a rapid expansion of online access designed specifically to bypass those traditional hospital bottlenecks we just talked about. By scaling these digital health services nationwide, the government is essentially laying down brand new digital train tracks for healthcare delivery. This milestone is a huge sign of a rapidly accelerating system. It proves the underlying digital infrastructure isn't just working on paper, it's highly capable of handling incredible, population-level scale without buckling under the pressure. Now, what's really interesting about this is how logically and quickly this whole progression happened. Step 1, the government policy shifts toward a digital-first access model. Step 2, the actual technical rollout of these platforms happens across the country. And finally, Step 3, rapid public adoption rockets the system straight to that 25 crore milestone. The sheer speed of this transformation is wild. It decisively proves that when you pair accessible digital tools with essential services, public adoption is a sprint, not a hurdle.
Section 4. The future of healthcare.
So, the crucial point is this. 25 crore registrations is a new baseline. It is absolutely not a finish line. This rapid expansion is fundamentally rewriting the rulebook on how citizens are going to interact with medical professionals for decades to come. Once an entire population gets used to the speed, the dignity, and the efficiency of booking a doctor's appointment online, they aren't going back to waiting in line. The cultural expectations have permanently shifted. This means the healthcare system now has to continuously innovate on top of this digital layer, bringing even more complex services directly to our fingertips.
Which brings us to the ultimate question to leave you pondering. How will this rapid shift to digital services actually change your next doctor's visit? Are we going to see fully integrated digital health records popping up on our phones? Maybe AI-assisted pre-screenings before you even arrive at the clinic? Or telemedicine seamlessly linked to your digital OPD profile?
The underlying infrastructure is there now, literally proven by 250 million separate interactions. I really want you to think about the real-world, personal impact of this digital transformation the next time you or a loved one needs to access care. Thank you so much for joining me for this explainer. Keep analyzing the world around you, and I'll catch you next time.